What if the problem isn't your knees, but the direction you're walking? That might sound strange at first, but recent clinical studies are pointing to something genuinely surprising. In trials involving people with chronic knee osteoarthritis, those who added backward walking to their routine saw their pain drop in just a few weeks. Nothing else changed. Same knees, same daily life. The only difference was the direction they moved. When researchers looked closer using motion tracking technology, they found that walking backward shifts the forces inside the knee joint. Different muscles fire, the pressure moves. Even key markers linked to joint stress begin to decrease. In this video, I'll break down what the science actually shows, why this simple shift can matter, how to try it safely, and what it realistically can, and can't, do for your knees. If you're living with chronic knee pain, you already know how exhausting it can be, and you're definitely not alone. Millions of adults in the US deal with knee osteoarthritis, especially after 60. The stiffness, the flare-ups, the way it limits simple things like stairs or long walks, it adds up. Most people hear the same advice: rest it, ice it, take an anti-inflammatory, maybe try some stretches. Physical therapy helps many, but sometimes progress stalls. Surgery is an option, but it's a big step, expensive, invasive, and not something anyone jumps into lightly. So when studies began suggesting that something as simple as walking backward could reduce pain, even many clinicians raised an eyebrow. Walking is walking, right? How much difference could direction really make? But here's what researchers discovered. The knee joint isn't just a simple hinge. It's a complex structure where forces are distributed differently depending on the direction you're moving. When you walk forward, which is what we do thousands of times every day, those forces concentrate in predictable patterns. Over years and decades, especially if you have even slight misalignment or muscle imbalances, those repetitive forces can contribute to cartilage breakdown, particularly in the inner or medial compartment of the knee. So researchers asked a simple question: what happens if we reverse those forces? And the results surprised even experienced biomechanics experts. Let me share the key research that changed how we think about this. In a randomized controlled trial, researchers took 32 patients with knee osteoarthritis and divided them into two groups. 16 patients received conventional therapy alone, the standard treatments for knee arthritis. The other 16 received the same conventional therapy plus structured backward walking training. Both groups continued for 4 weeks. Now here's what happened. After 4 weeks, both groups improved, which makes sense because conventional therapy does help. But the backward walking group improved significantly more. Their pain scores, measured on a standard numerical rating scale, dropped to an average of 1.56 compared to 2.25 in the control group. That's a meaningful difference in day-to-day pain levels. Their knee function scores, measured using something called the WOMAC scale, which assesses things like walking, climbing stairs, and getting in and out of chairs, improved to 11.69 compared to 16.19 in the control group. Remember, lower scores are better on this scale, so this represents substantially better function. Before we continue, I want to mention something important. If you're over 60 and trying to stay strong, independent, and pain-free, you've probably realized by now that random tips from the internet just aren't enough. That's exactly why I created the 60+ Vitality Blueprint. It's not another trendy diet or extreme workout plan. It's a complete, science-based system built specifically for the 60+ body, based on the latest U.S. nutrition and physical activity guidelines for 2025 and beyond. Inside, you'll find a clear 12-week roadmap. That includes structured meal plans tailored to your body type and goals, whether you want to protect muscle, lose fat safely, or simply maintain your strength. There's also a progressive strength system, from gentle chair-based routines to more active programs, so you can build stability and reduce fall risk without needing a gym. If you're managing heart health, type 2 diabetes, or bone loss, there are dedicated nutrition protocols designed specifically for those conditions. Plus, a simple supplement guide explaining what actually matters after 60, and what to avoid, especially if you're on medication. And because real life matters, there's even a practical grocery system for stores like Walmart, Costco, and Aldi, including budget-friendly swaps. If you're serious about staying active, mobile, and independent in the years ahead, the link to the 60+ Vitality Blueprint is in the description and pin comment below. Take a look after the video and see if it's right for you. Now, let's get back to what the science says about walking backward and your knees. But researchers also measured something else: balance and stability. They use sophisticated equipment to measure how much people sway when standing still, something called center of pressure measurements. The backward walking group showed significantly better static stability, meaning they had better balance and less swaying. Why does balance matter for knee pain? Because better balance means fewer micro instabilities stressing the knee joint throughout the day. It means less compensatory strain on surrounding muscles and ligaments. Let me tell you about Dorothy, one of the participants in a similar study. Dorothy was 72 years old and had been dealing with knee osteoarthritis for 8 years. She described her pain as constant, rating it a 6 or 7 out of 10 most days. Walking more than 2 blocks required her to stop and rest. Stairs were becoming difficult. She'd tried various medications, physical therapy, injections. They helped temporarily, but the pain always came back. When Dorothy enrolled in the backward walking study, she was skeptical. How could walking backward do anything that forward walking hadn't already done? But she committed to the protocol: 10 to 15 minutes of supervised backward walking 3 times per week, alongside her regular therapy exercises. After 4 weeks, Dorothy reported her pain had decreased to a 3 out of 10. After 8 weeks, she could walk 4 blocks without stopping. She could climb a full flight of stairs without gripping the railing. She described feeling more confident in her movements because her balance had improved noticeably. So what's actually happening inside the knee during backward walking that creates these results? The biomechanics are fascinating. Researchers used sophisticated gait analysis laboratories with 3-dimensional motion capture systems and force plates embedded in the floor to measure exactly what happens at the knee during forward versus backward walking. What they discovered was remarkable. When you walk forward, a specific mechanical force called the external knee adduction moment, which researchers abbreviate as EKAM, concentrates stress on the inner or medial compartment of your knee. This is the area where osteoarthritis most commonly develops. Think of EKAM as a measure of how much sideways bending force is pushing inward on your knee with every step. During backward walking, researchers measured a significant decrease in both the first and second peaks of this external knee adduction moment. They also measured something called knee adduction angular impulse, which is basically the total accumulated stress over the entire step. Both measurements decrease significantly during backward walking. What this means practically is that backward walking reduces the mechanical stress on the most vulnerable part of your knee, the medial compartment where arthritis typically develops and worsens. But that's not all. Researchers also used electromyography, or EMG, to measure muscle activation patterns. They placed sensors on the thigh muscles to see which muscles fire and when during forward versus backward walking. What they found was that backward walking significantly increases activation of a muscle called the vastus medialis oblique, or VMO for short. This is the inner quadriceps muscle that acts as a key stabilizer for your kneecap. It keeps your kneecap tracking correctly in its groove as you bend and straighten your knee. Many people with knee pain have weak or poorly activated VMO muscles, which contributes to improper kneecap tracking and patellofemoral pain. The studies showed that backward walking not only increases VMO activation, but also maintains a favorable ratio between the VMO and the outer quadriceps muscle. This balanced activation pattern is exactly what physical therapists try to achieve with various strengthening exercises. But backward walking seems to naturally create this pattern just by changing your direction of movement. There's also the matter of joint lubrication. Your knee joint contains synovial fluid, which acts as a lubricant and shock absorber. Every time you take a step, The compression and release of your cartilage helps circulate this fluid and distribute it throughout the joint. Classic biomechanics research shows that this cyclic loading maintains fluid pressure and supports the cartilage's ability to withstand stress. Backward walking changes how and where that compression occurs, potentially distributing the fluid to areas that may not get as much circulation during normal forward movement. Now, you're probably wondering about the practical question. How do you actually do this, and is 5 minutes really enough? Let me be honest about something important. While the title mentions 5 minutes, the actual clinical trials that showed these benefits typically used 10 to 20-minute sessions, performed 3 to 5 times per week for at least 4 weeks. That's the protocol that produced the measurable improvements in pain and function we've been discussing. Could 5 minutes provide some benefit? Possibly, especially if done consistently. But to match the results from the research, you'd want to work up to longer sessions over time. Here's how to approach backward walking safely, especially if you're dealing with knee pain. First, and I cannot stress this enough, start in a safe environment. This means a flat, clear hallway, or better yet, a walking track or large open space where you can see behind you or have someone guide you. Many people start by walking backward on a treadmill at very slow speeds, which provides handrails for safety. Never attempt backward walking in an area with obstacles, uneven surfaces, or where you could trip over something. Start extremely slowly. Your first session might be just 2 to 3 minutes at a very gentle pace. The goal initially is not exercise intensity. It's getting your nervous system comfortable with the movement pattern. Keep your posture upright, don't lean forward or backward. Lift your knees slightly with each step rather than shuffling. Look over your shoulder periodically or have a partner guide you. Your arms should swing naturally to help with balance. As you become more comfortable over several sessions, gradually increase your time. From 3 minutes to 5, then to 10, then 15. Most studies had participants work up to 15 to 20 minutes per session within the first week or two. The pace should feel comfortable. You should be able to hold a conversation while doing it. If you're breathing hard or feeling unstable, you're going too fast or doing too much too soon. Consistency matters more than intensity. 3 sessions per week for a month will produce more benefit than 1 long session per week. Some people experience mild muscle soreness in the first few sessions, particularly in the quadriceps and calf muscles. This is normal and indicates you're using muscles in different patterns. However, if you experience sharp pain, increased knee swelling, or instability where your knee feels like it might give out, stop and consult your physical therapist or doctor. Backward walking should feel different but not painful. But there's an important question we need to address. Does backward walking actually repair cartilage, or is something else happening? I want to be completely transparent about what the research has and hasn't proven. The clinical trials I've been describing measured pain levels, functional ability, balance, and joint loading forces. They did not directly measure cartilage regeneration or repair using MRI or other imaging. So, scientifically, we cannot yet claim that backward walking repairs or regenerates damaged cartilage. That may be happening, but it hasn't been proven in published studies yet. What we do know is that backward walking reduces pain, improves function, enhances muscle activation patterns, decreases mechanical stress on the most vulnerable part of the knee, and improves balance. These are real, measurable, clinically meaningful improvements. The pain reduction could be happening because you're reducing the repetitive stress on damaged areas. The improved function could be from better muscle support and stability. The enhanced balance reduces compensatory strain. All of these contribute to feeling better and moving better, even if the underlying cartilage damage remains. It's also worth noting that in some comparison studies, backward walking was found to be at least as effective as forward walking for knee osteoarthritis symptoms, and in several trials, it was more effective when added to conventional therapy. A recent systematic review and meta-analysis concluded that backward walking improves lower limb strength and reduces knee adduction moment, supporting its recommendation in knee rehabilitation programs. This is not fringe science. This is appearing in peer-reviewed journals and being incorporated into evidence-based practice guidelines. So who should try this, and who should be cautious? Backward walking appears most beneficial for people with mild to moderate knee osteoarthritis, patellofemoral pain syndrome, or general knee discomfort from overuse or aging. The clinical trial specifically studied osteoarthritis patients with good results. It's also being used successfully in rehabilitation after certain knee surgeries, though always under professional guidance. People who benefit most are those who can already walk forward without significant instability and are looking for an additional tool to reduce pain and improve function. However, some people should be very cautious or avoid backward walking entirely. If you have severe balance problems or a history of falls, backward walking without constant assistance could be dangerous. If you have severe osteoarthritis with bone-on-bone contact and significant instability, you need direct physical therapy guidance before attempting this. If you have vertigo or inner ear problems that affect spatial orientation, backward movement can trigger symptoms. And if you have neuropathy or reduced sensation in your feet, your risk of tripping increases significantly. The safest approach is to discuss backward walking with your physical therapist or doctor. They can assess your specific situation, your balance, your knee stability, and help you determine if this is appropriate for you. Many physical therapy clinics are now incorporating backward walking into knee rehabilitation protocols based on this emerging research. Having professional guidance, especially for your first several sessions, significantly reduces risk and ensures you're doing it correctly. Let's talk about realistic expectations. The studies showed improvements over 4 weeks of consistent practice, not after one session. Dorothy, the patient I mentioned earlier, didn't experience dramatic change in week 1. It was gradual. By week 2, she noticed she was moving with slightly more confidence. By week 4, the pain reduction was clear. By week 8, the functional improvements were substantial. This is not a quick fix. It's a gradual process that requires consistency. So here's what we know. Randomized clinical trials show that structured backward walking, added to conventional therapy, significantly reduces knee pain and improves function in people with osteoarthritis. Biomechanical studies show it changes joint loading patterns and muscle activation in beneficial ways. It's low cost, requires no equipment, and can be done almost anywhere safely. Is it a miracle cure? No. Will it work for everyone? Probably not. But does it represent a legitimate, evidence-based tool for managing chronic knee pain? Absolutely. If you're dealing with chronic knee pain and you've tried conventional approaches without complete relief, backward walking might be worth discussing with your healthcare provider. Start slowly, prioritize safety, be consistent, and give it time. Your knees have been moving forward for decades. Teaching them to move backward might just teach them to feel better. Thanks for spending this time with me. If this helped you see your knee pain a little differently, consider sharing it with someone who might need it too. I'll continue bringing you research-backed strategies to help you stay active, mobile, and confident as the years go on. And I'd genuinely like to hear from you. Have you ever tried walking backward for your knees? Did you notice any difference? Drop your experience in the comments. I do read them. Take care of your joints, keep moving in ways that feel safe, and remember, sometimes the smallest adjustments can make the biggest difference over time.